gentlemen. Welcome to Nationwide.
Good evening.
Good evening. Good. Let me begin with you, Dr. Frey, out west. What is the situation like at Cornwall Regional in terms of your ability to cope and to care for people with COVID-19?
Well, as you have known in the past, over the past 2 months, we have had an influx of admission as it relates to COVID-19 patients. In fact, I wanted to check the data for today, but that is not much different from yesterday. I had the data for yesterday, which we prepared to talk last night. So yesterday we had 52 patients in hospital, and the total number of patients that were in hospital yesterday morning was 310. And I don't think, looking roughly at the data for today, that has changed much. As you know, our capacity at the Cornwall Regional Hospital, based on what we have done in the past, on site we are able to house 284 patients. So if yesterday we had 310, you can see that, we have an excess number that we had there, and that is a strain on the system.
But what is the trend? What is the trend you're picking up in terms of COVID-19 hospitalizations?
Well, it varies anywhere between 45 to 55 over the past month of patients being admitted. Mm-hmm. So that has not changed much. We are hoping that the measures that were instituted, you wouldn't see the effect now, but probably, in another week or so, we will see how that impacts on the admission rate.
Mm-hmm. And in the Southern Regional Health Authority, Mr. Bent, what is the state of play there?
Okay, Chris. Good evening again to you.
Good evening.
Right. As of this morning, we had 80 cases of COVID-19, confirmed cases throughout our 5 hospitals. We have a bed capacity of 98 for COVID beds, so we have 80 confirmed cases. But of course, we have some suspected, which we are waiting results on too as well. About another 40.
Mm-hmm. So you're pretty close to capacity.
Right, as a matter of fact, we had capacity in some of our facilities, but just when about 1, 2, 3 or 4 facilities we had capacity, and we have a little space in just about 2 of the hospitals.
Mm-hmm. And how are you in terms of oxygen supply, Mr. Bent?
Okay, we are better than a couple weeks ago. We are good now. I mean, let's say good, because that is relative. That depends on the demand. But as of now, we have oxygen that should be able to last us. If they based on our current usage, we should have oxygen to last for another 5 or 4 days average. Mm-hmm. But we are expecting another delivery of oxygen over the weekend just to boost our capacity.
Mm-hmm. And how consistent or reliable is the supply now, given the pressure that IGL is under?
Right. So the last 2 or 3 weeks ago, we had reached a very concerning level, I must say. We never ran out, but we had reached some very concerning levels. This week has been a little better. What has happened now is that we have to be getting oxygen almost daily. In some cases, we had to be getting it daily. Previously, we used to get like once or twice per week. Now we are getting daily. Mm-hmm. And they are responding, even not to fill all the gap in terms of what our daily request is, but at least we get some oxygen that can take us throughout the days.
Mm-hmm. Dr. Frey, how is Cornwall Regional in terms of oxygen supply?
Well, we're a big hospital, and as he had mentioned, over the past few weeks we have had a challenge because IGL is not able to deliver the amount that we require. So we have been running at about 50 to 60% capacity. And the way we maintain that is that we need daily supply from IGL. So what we have to do is, we have to ensure that the oxygen is delivered And sometimes, we are far away. Sometimes there is a delay, and we have to now juggle with what we have in terms of the good thing about Cornwall. We have 3 bulk sources, so we can, juggle around with the cylinders, and we can move cylinders around to areas where, they are required when there is, the supply is not maintained. But so far we are trying on a daily basis to get daily supply, but that's the only way we can maintain what we have here in order to serve our patients.
So you've
and
not...
that by itself is a difficult task, as you can just imagine, from our proximity to the source of where the oxygen is. So it requires a lot of administrative work and coordinating in order to maintain what we need to have.
So, Dr. Frey, you've not had a day that you've gone without oxygen?
Well, I wouldn't say not a whole day. We might have an hour or so where there's a location that might be short, and then we have to, readjust in order to move cylinders from an area that they are not used that often to that area. Sometimes we have to borrow cylinders from as far as Lucy Hospital or Falmouth Hospital, and that's why I said it requires meticulous work on the administrative department and liaising with us in order to maintain that flow. So I wouldn't say that not a whole day, but probably an hour, but none of our patients suffer from that because we're on top of the situation in order how to juggle and to move the oxygen. Sometimes we can fill the cylinders from the bulk source in order to maintain what is happening. Mm-hmm. It requires a lot of work. We would love to see the situation restore where we get our 100% capacity, and we know that could run us for, over 24 to 48 hours. And that's what we are looking forward to. And we trust that IGL is putting implementation in place in order to provide that need for us. And I'm sure it might be similar to the other hospitals in the country as well.
Michael Bent, have the hospitals under the auspices of the Southern Regional Health Authority, have they gone a day without oxygen?
No, we have never had that where any facility ran out. As Dr. Frey, just like in Dr. Frey's piece down in, what we have to do is to monitor consistently throughout the day. And so from time to time we'll have to shift a couple of cylinders from one hospital to another because but we have never gone a day, no time at all, without oxygen in any of our facilities. But because it has been monitored closely and regularly, and we have to be doing the shifting or juggling so that we can maintain life and sustain life in our hospitals.
Mm-hmm. Mr. Bent, nurses, the availability, the migration of your nurses, how is that going? It's a constant trek?
Well, there was a lull, but reports are now it is basically stepping back up. So there was a lull sometime last year, but I'm now seeing the numbers of resignations going up early, but not as high as it was pre-COVID. But I'm seeing it is going in that direction now in terms of residents. Opting to go.
So over the last month versus the previous, how many resignations are you looking at?
I can't tell you something, but it is not many though. I'm just saying, I don't think we have more than about 8. I don't think we have about that.
So in terms of what your complement provides for, yes? Are you at full complement or how short are you now?
No, man, I've never been at full complement at the time, especially with the specialist nurses. We have never been there. Yes, we can find the RN and so on, but in terms of specialists, we have never been. There's always been gaps. We have not been, I would say we are about 70% of where we should be, but there has always been gaps.
And that has been the average, 70% of complement?
Right, for the specialists.
Mm-hmm. What about you at Cornwall Regional, Dr. Frey?
Well, Mr. Hughes, if I knew about that question, I could have asked the matron. So I couldn't tell you in terms of, but we have never had full capacity of nurses, as was mentioned before. What we have to do is to, use what we have to the best of our ability. And as Mr. Bennett has said, the specialist here, in fact, the care of COVID patient requires specialist care.
Mm-hmm.
So that is in by itself is a stress on the system. So you might find that, one nurse has to work 2 shifts, then your rest are on the 3rd shift. That sort of thing. We have never had full capacity, but the patrons are able to monitor what they have and to use it to the best of our ability to get the patient to the best care that we can give. It would be nice if we had, the full complement. And one of the advantages we have here at Cornwall Regional Hospital, we had some nurses that came in from Cuba who work in our COVID unit, who are, specially trained for that sort of thing. And they do very well and work very hard as well. So that helps us a great deal.
Mm-hmm. And where doctors are concerned, you're in a better place in terms of the numbers and availability, Dr. Frey?
Well, in terms of number, that has improved, over the past month. The ministry made an injection of some requests that we made, and we got the staff in place to work, to do what we want to do. So we were happy for that. I wouldn't tell you that they are not stressed because, as I said before, this is intensive work on everybody's part, especially doctors and nurses. And, you have to juggle around that. We are trained to deal with pandemics or any situation like this, and you have to adjust. The only sad thing about this is that this is going on much longer than, we are hoped for. And we are hoping that it will break somewhere soon because you can work to just a certain extent and then, you just can't work anymore. But we have to manage it very carefully. Like we manage the staff so we can rest them and, bring them back on, that sort of thing. And that is important in order to manage the situation here.
Mm. What about you, Mr. Bent, in the southern part of the island?
Well, somewhat similar in that we have to manage what we have. I wouldn't say that we are worse off in terms of numbers than pre-COVID, but certainly it has been a year and some months now, and the team going at it, so we have to manage them. Some rest, just similar with the nursing situation, to some go on the rest, and we take them back because we have to preserve our human resources. Because we have very long hours, very long. And we also about the hospital as well as the primary care too, because the primary care staff members, especially the nurses and so on, who have to be doing the contact tracing, and some of them not even going into the vaccinations and so on. So it is a lot.
Well, from where you sit, Mr. Bent, admissions, hospitalizations, flattening, trending down, or trending up?
In terms of generally, or not COVID, just general.
COVID admissions.
Okay. And I would say it is, if I should look at it since the beginning of this year, I would say it's about, I can say it's flat over the last 2 months. Right, it went up, but I think it is, I don't know if I can say it's flattening yet. I don't think I can say that yet, but numbers are pretty consistent in terms of on the higher end.
Mm-hmm.
I would want to say it's flattening yet.
Yes, what about you, Dr. Frey?
I would concur with Mr. Bent. It's about flat now for the past 2 weeks.
Mm-hmm.
The number we admit for COVID and the number discharged. The good thing that, the vast percentage of COVID patients admitted, they get better and go home. Some might have a longer hospital time. And, of course, a few will die based on, their presentation and their comorbidities. But, it's more or less static for the past 2 weeks, I would say.
Okay.
Well, all right, gentlemen, thank you very much for joining us in this segment. Michael Bent, Regional Director at the Southern Regional Health Authority, and Dr. Delroy Frey, Clinical Coordinator at the Cornwall Regional Hospital out west in St. James. Thank you, gentlemen, for having joined us.
After the break, we take your calls. But Tyrone?
Yes.
Have you been seeing what's being reported on social media?
I've been trying to keep up.
Since Nationwide posted this
the photo
morning.
of
the photograph of